1. When a problem behavior has been targeted for reduction or elimination, the behavior analyst must always include in blank in the intervention plan. A. Replacement behavior. B. Appropriate response. C. Pivotal behavior. D. Performance criterion. Two. Which experimental design is most appropriate for evaluating the effect of video modeling on the acquisition of the skills for preparing a meal by adults with developmental disabilities? A. Multiple baselines across behaviors. B. Changing criterion. C. Multiple probe. D. Delayed multiple baselines. Three. Blank involves collecting baselines on the same behavior of several persons, preferably in different settings. A. Multiple baseline across individual design. B. Multiple baseline across behaviors design. C. Alternating treatments design. D. Reversal design. Four. Carr and Lovis 1983 recommended that practitioners experience any punisher personally before the treatment begins. For what reason? A. It reminds the practitioner that it is a sadistic procedure. B. It reminds the practitioner that the technique produces physical discomfort. C. It reminds the practitioner that the technique is designed to increase the appropriate behavior of the student. D. It allows the practitioner to determine a baseline of discomfort which he or she then increases rapidly as it is administered to the student. 5. Dr. G, a respected behavior analyst, answered behavior questions on a radio show. The producer wanted him to use callers' names and sound empathetic, but Dr. G preferred a direct approach. What should he do? A. Try to be warmer while maintaining his ethics and not making statements that suggest he knows more about the caller than he does. B. Do whatever the producer says so he doesn't get fired. C. Continue what he is doing regardless of the outcome. D. All of the above. 6. Sean was responsible for designing an intervention for a 5th-grade student who engaged in severe problem behavior consisting of throwing chairs at the teacher when an assignment was given. Sean decided to utilize a contingent physical restraint every time the child threw a chair. Sean is violating the ethical consideration of A. Right to safe and humane treatment. B. Least restrictive alternative. C. Right to effective treatment. D. Sean is not violating any ethical considerations. 7. Blank is an experimental design in which 2 or more conditions are presented in rapidly alternating succession independent of the level of responding. A. Multiple baselines across settings. B. Reversal design. C. Withdrawal design. D. Alternating treatments design. Eight. When using behavioral momentum, behaviors selected for a high P request sequence should A. Be part of the learner's current repertoire. B. Be new behavior or behaviors the learner has to acquire. C. Have a very long duration of occurrence. D. Be those behaviors with which the learner is not complaint. Nine. Which of the following is not a factor that influences the effectiveness of punishment? A. Immediacy. B. Intensity. C. Variation. D. Schedule. Ten. The design consists of an initial baseline phase followed by an intervention phase followed by a return to baseline. A. ABA. B. Reversal design. C. Withdrawal design. D. All of the above. 11. Non-contingent reinforcement involves the presentation of A. Stimuli with unknown reinforcing properties that are delivered on a fixed time or variable time schedule independent of the learner's behavior. B. Stimuli with known reinforcing properties that are delivered on a fixed time or variable time schedule independent of the learner's behavior. C. Stimuli with known reinforcing properties that are not delivered on a fixed ratio or variable ratio schedule independent of the learner's behavior. D. Stimuli with known reinforcing properties that are delivered on a fixed time or variable time schedule dependent on the learner's behavior. Extinction may involve which of the following? A. Increase in rate of target behavior. B. Increase in intensity of target behavior. C. Increase in a variety of behaviors. D. All of the above. All of the following are limitations of the multiple baseline design except A. It may not reveal the functional relationship, even if one exists. B. Verification of predicted behavior change must be inferred from other behaviors. C. The behavior under study must be within the subject's repertoire already. D. It is weaker than the reversal design. A contingency contract. A. Is a verbal agreement between two individuals. B. Specifies how two people will behave toward each other. C. Often causes scapegoating among learners and peers. D. Depends largely on the use of punishment for its effectiveness. The principle of determines the degree to which a person's behavior repertoire maximizes short and long-term reinforcers for that individual and for others and minimizes short and long-term punishers. A. Normalization. B. Habilitation. C. Functionality. D. Justification. Which form of verbal behavior is evoked by a verbal discriminative stimulus and has point-to-point correspondence and formal similarity with the response? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Which form of verbal behavior is evoked by a verbal discriminative stimulus and does not have point-to-point correspondence with that verbal stimulus? A. Manned. B. Tact. C. Echoic. D. Intraverbal. 18. Motivating operations and discriminative stimuli. A. Have similar evocative effects on behavior. B. Are considered synonymous. C. Occur after the behavior of interest. D. All of these. (19) Which statement best describes recovery from punishment? A. After punishment is discontinued, sometimes the behavior that experienced the punishment contingency will recover. B. When the punishment contingency is implemented, the behavior of interest may initially increase in rate, followed by a rapid decline in frequency. C. After punishment is discontinued, the behavior of interest may gradually reappear, only to disappear on its own, regardless of existing environmental contingencies. D. The period of time the implementer of the punishment contingency requires to recover from the emotional side effects of using punishment. (20) A stimulus change that does not elicit respondent behavior is A. Discriminative stimulus. B. S delta. C. Neutral stimulus. D. Punishing stimulus. (21) Little Peter was walking along the fence of his uncle's dairy farm. Peter reached up and grabbed the wire along the fence, not realizing it was electrified. After recovering from the pain caused by the shock, Peter never again touched the fence wires. Which statement best describes the shock stimulus felt by Peter? A. Negative reinforcement. B. Negative punishment. C. Bad judgment. D. Positive punishment. (22) The primary reason one might consider using a level system with a token system is that A. Doing so can foster self-management. B. Doing so makes it easier to withdraw the token economy. C. Level systems are more preferred for all learners. D. Level systems are easier to manage. BCBA Practice Test. A Board Certified Behavior Analyst, BCBA is a professional who has obtained certification in behavior analysis. They are trained to assess, analyze, and modify behavior to improve the lives of individuals with developmental disabilities, including autism, through the use of behavior therapy and interventions. Certification requirements. Earning this credential requires a master's degree, 1,500 hours of supervised experience, and passing a comprehensive exam. The process ensures practitioners are equipped to handle complex behavioral challenges with expertise and ethical precision. The certification enhances career prospects, fosters professional growth, and promotes meaningful change in clients' lives. It validates expertise in creating tailored interventions that improve communication, social, and adaptive skills, while supporting continued learning in the field.